So my name is Anne Wilson. I work at Durham University in the UK, and I'm going to talk about integrated vector management for Aedes-borne disease control. So I'm going to quickly cover the rise of Aedes-borne diseases. That's been talked about quite a lot so far, and then outline what IVM, what integrated vector management is, how we can involve the non-health sector and communities in vector control, challenges for IVM, and some opportunities to strengthen IVM. So there's been a huge rise in the global burden of arboviral diseases. Outbreaks are increasing in frequency, magnitude, and in geographic distribution. It's important to consider that, it's also been mentioned before, but important to consider that we don't know other viruses that might be coming that might be more pathogenic than those currently circulating. In terms of vectors, I'm going to talk mainly about Aedes aegypti, but also Aedes albopictus is a problem in rural areas, and it's important not to forget also Culex vectors. And I think we need to consider Aedes-borne diseases together collectively rather than talking about single disease control. So urban environments can be considered to be an all-you-can-eat buffet for Aedes mosquitoes. There's been a massive increase in urbanization, and this creates high population densities. In some settings, there's also poor housing quality, water insecurity, which leads to people storing water in their houses, which creates great habitats for Aedes. There's a lack of sanitation and refuse collection, and environmental deterioration in some places. So this has also been shown before. It's the predicted global distribution of Aedes aegypti in 2015, but it's overlaid with the red dots are all cities with more than 1 million inhabitants. So you can see there's going to be a huge problem of Aedes aegypti in urban environments. So what is integrated vector management? So it's the WHO recommended approach for control of vector-borne diseases worldwide. It can be seen as an evidence-based, adaptive, and multi-sectoral approach to vector control. So what do we mean by this? So in terms of evidence-based, it's the use of proven tools, either singly or in combination, and they're selected based on knowledge of the local vector and disease situation. By adaptive, I mean that the program adapts based on vector surveillance and monitoring and evaluation, so you look at the impact and then you potentially change what you're doing. And lastly, by multi-sectoral, it means we use tools from both within and outside the health sector, and we involve communities as well. So this figure outlines the steps involved in IVM, and this is taken from this document, plug. I have 3 copies if anyone wants one. So the first step is to assess the disease situation. So this involves an epidemiological assessment and assessing the vector as well. And then you would stratify and also look at local determinants of disease. Then you select your vector control methods. This method should be proven, this should be efficacious, but you'll also look at other considerations such as insecticide resistance. You need to consider needs and resources, and then implement your program. And this should always be accompanied by monitoring and evaluation, and then there's a feedback loop again. So control of Aedes vectors in terms of tools should have a 3-pronged approach. So the first thing is the use of vector control tools. We have existing tools, there's new tools coming. The tools should target both adults and the immature vector stages. And as Raman mentioned, we should have routine measures which are sustained, and we should have measures that we use for outbreak control. The second prong is that of community mobilization and engagement, and this relies on a good understanding of the communities in which you're working. And lastly, we need to engage with the non-health sector. And these are generally longer-term methods. They can be complicated, messier to implement, but they're really important. So by making use of non-chemical and chemical vector control methods, so mainly source management, environmental management, IVM can be seen to be an insecticide resistance management strategy, and I think this is really important. So next I'm going to talk about how we can engage communities and the non-health sector in AIDS control. And this comes back to the great point from our colleague here about that basically it's not just about deploying tools. There are other things we can be doing. Sanitation was mentioned. So I think this is really important to keep in mind. So this is a nice figure I found. It's a framework for dengue risk, and it outlines all the different types of things we should consider when we're looking at dengue risk. And I'm going to focus here on this bit in red, which looks at determinants of community susceptibility to dengue and other Aedes-borne diseases. So this includes things like housing type, urban planning, municipal services like water, sanitation, solid waste collection, education, access to healthcare, cultural practices, and public policies, and lastly, control measures. So these are all determinants that can be dealt with by using IVM. So I'm going to give some examples of how these can be tackled with IVM in more detail. So the first one that we could consider is improving housing. So this includes things like screening doors and windows that keep the vector out of the house. So there's been a number of studies on this. This is one from Mexico, which was a randomized controlled trial looking at insecticide-treated window and door screening, and they combined that with targeted larviciding of breeding sites in Acapulco, Mexico. And this showed a reduction in entomological indices. I think the study is ongoing with clinical endpoints, but it looks very promising. When we're thinking about housing, we need to consider how this could be scaled up. So how can we work with private sector to develop new, more robust screening, which we could put on doors and windows? Can we mandate these improvements in building codes, so working with legislators to enforce these measures? And could this be done in workplaces and schools as a good first step? So the second example is on municipal services, so water, sanitation, solid waste management. So I think it's important to ensure water access because secure water supplies prevent people hoarding water. So we could work with water supply companies, with local authorities to try and make this happen. Second thing is storm drains. It's a good example. These are a habitat for Aedes in a number of countries, Mexico, Colombia, Brazil. And although we could use larviciding here, I think it's important to think about how we could engineer these better to prevent the accumulation of water. So in the long term, this should be a priority. And lastly, rubbish disposal. So there's a few good examples of where solid waste management has been improved for Aedes-borne disease control. So the first comes from Mérida in Mexico. So this is a program where they incentivized recycling. So they chose at-risk communities, and they offered vouchers which could be used for basic foodstuffs or health benefits. And this was in exchange for large volumes of recyclable materials which the communities collected. So it's a cross-sectoral response. It was initiated by the local government, and it involved a number of different ministries. And here again, they showed significant reductions in entomological indices. Another example comes from Brazil. This is a private sector partnership to reduce waste tires. So it was between the Ministry of the Environment and an organization which was linked to the tire industry. And so users of tires were asked to bring them back to the shops where they bought them or to bring them to regional collection points. And then they were brought to central factories where they were recycled into flooring or used as an alternative fuel. So this brought a lot of income to factories which were then using the tires in the next step. The logistics were financed by the tire industry, and the land for regional collection points was made available by the local government. So this has been really successful in preventing tires lying around, acting as breeding sites. The other thing we should consider is community mobilization, so making communities aware and engaging them to clean up their own domestic and peri-domestic environments. So there's been, as Rahman mentioned, one randomized controlled trial of this in Mexico and Nicaragua. So clusters were randomized to conventional vector control plus or minus community randomization. So they recruited volunteers who visited the houses and educated people on where the vectors were breeding, what they could do to prevent it. There were cleanup campaigns, and also fish were put into containers in Mexico. So this is the first study so far that's shown a decrease in epidemiological endpoints for community mobilization. And it's a potentially small effect, but was significant. And I think it's important to do more studies in this area. And there was also a reduction in entomological indices. So IVMs is a really promising approach for control of Aedes-borne diseases. And it makes, like, hearing about IVM, it makes total sense that it's the right approach. But there's a number of challenges. So firstly, trying to get sectors to work together is notoriously difficult. Do you establish terms of reference? How do you get people talking together? How do you get political and kind of monetary buy-in from other sectors is complicated. Secondly, vector control programs are weak, and there's a lack of public health entomologists. Thirdly, we're not clear on what vector controls work, so things have been implemented without much evidence base behind them. So this also needs to be improved. And there's insufficient monitoring and evaluation and research. So how can we address some of these challenges? So there's opportunities to strengthen IVM for Aedes control. So the first one, which Rama mentioned also, is the WHO Global Vector Control Response. So this has been asked for by member states, and it's hopefully going to galvanize support for vector control, also for Aedes-borne diseases. So I'm just going to explain this figure here. So this is like the basis of the whole response document. So there's a foundation of research and harnessing of innovation, and foundation of enhanced vector control capacity. So looking at workforce, training, retention of staff. There's 4 pillars of action. So multi-sectoral collaboration, enhanced surveillance and monitoring and evaluation, scale up of tools and approaches, and engagement and mobilization of communities. So hopefully this will lead to more effective, locally adaptive and sustainable vector control to reduce the threat and burden of these diseases. The other thing Rama mentioned is to do with the sustainable development goals. So there's lots of opportunities here to link Aedes-borne diseases into this. And an important one is number 11 there in orange on sustainable cities, which looks at improving housing, basic services, slum upgrading, which is really important. Some other initiatives you might not know about, which can be kind of linked in with Aedes control. So the first one is the UN New Urban Agenda. So this was agreed upon at the Habitat-Free Cities Conference in Ecuador in October. And this will guide efforts around urbanization for the next 20 years. It's a really super high-level document, loads of stakeholders involved. The other thing is the 100 Resilient Cities, which is Rockefeller funded. So they've picked 100 cities around the world, and they're looking at ways to make them more resilient from chronic stresses and from acute shocks. So these can be seen to be things like flooding or climate change, but also we could consider Aedes-borne diseases as a potential shock to a city. And just a quick look at this, I found some stuff from Indonesia on, they've identified dengue as one of the shocks, but there's a real kind of opportunity to link Aedes-borne diseases into this initiative. And there's others that I haven't mentioned. So in conclusion, we need to think about Aedes-borne diseases together rather than single disease control. IVM definitely can be an insecticide resistance management strategy. We need to look for opportunities outside of the health sector. And I think working towards creating undesirable cities for Aedes aegypti should be a real goal that we should work towards long term. And as Annalise said, most effective control will be achieved using multiple approaches in combination. That's it. Thank you.